The three components you have to go through for the care of the central venous catheter, or CVL, are hand washing, changing of dressing, and flushing. Before handling the catheter, it is important to keep your hands clean. These are the steps you should follow for proper hand wash. Wet hands and wrist. Apply soap, palm to palm. Right palm over left, then left over right. Fingers interlaced. Back fingers to opposing fingers interlocked. Rotate rubbing of both thumbs. Rub fingertops. After your hands are clean, pat dry with a clean towel. Changing of dressing. The 4 steps of changing of dressings are preparations, removal of dressing, cleaning of the site, and putting on new dressing. Prepare your items on a tabletop. Ensure that your tabletop is clean before you place any items on it. The items you will need for changing the dressing are chlorhexidine lotion, CHG. If CHG is not available, you may replace it with povidone iodine swab stick, dressing pad, micropore tape, and alcohol swab. Gently remove the old dressings. Check for any redness, swelling, or discharges from the exit site. Ensure that the stitches are intact. Wash your hands thoroughly again and pat dry with a clean towel. With a CHG, clean the exit site in a downward left to right motion. Do not touch the exit site with a swab that has made contact with any skin. Allow CHG to air dry for about 1 to 2 minutes. Do not blow on the exit site, as it may cause contamination. Cover the exit site fully with a dressing pad. Tape the catheter to the skin and ensure it is not kinked or pinched. The 3 steps of flushing are preparation, changing the cap, and flushing of the CVL. Before you handle the catheter, be sure to wash your hands thoroughly. Ensure your tabletop is clean before placing items on it. The items you will need are 5 ml syringe with attached needle, 5 ml heparin saline, 2 pieces of alcohol swabs, a packet of sterile gauze, and micropore tape. Clean the neck of the heparin saline with alcohol swab before opening the cap. Remove the needle cover of the syringe. Insert the needle into the heparin saline. Pulling the plunger, withdraw at least 4.5 ml of heparin saline. Replace the needle cover without contaminating the needle. Push the plunger to release the air in the barrel. Wash your hands thoroughly again and pat dry with a clean towel. Remove the old tape around the yellow cap. Clean the connection between hub and yellow cap with alcohol swab. Remove the yellow cap. Remove needle from the syringe and connect syringe to hub and lock the syringe. Release the clamp. Slowly inject the heparin into the catheter. There should not be any resistance. As you are injecting the last ½ millimeter of heparin, clamp the catheter immediately. Prepare a new yellow cap. Remove the syringe from the injection port and replace with a new cap. Tape the catheter to the skin and ensure it is not kinked or pinched.
Called a non-coring needle, and it's shaped to not damage the port when inserted.
Hand hygiene is one of the most important practices for infection prevention.
The site is felt to determine exactly where the non-coring needle will be inserted.
Tell us if you have any pain at the site.
Once a work area has been cleaned, the nurse opens the central line kit. If you're unable to tolerate wearing a mask, you'll be asked to turn your head away from the port site.
Before proceeding, your nurse will wash their hands again. The needle is placed on the sterile towel from the kit. The nurse puts on sterile gloves. The needle is filled with normal saline, being sure not to touch or contaminate the rest of the sterile field.
Using chlorhexidine, the port site is cleaned by scrubbing the area up and down and sideways for 30 seconds.
Once the area is dry, the port is immobilized by pressing down on the base of the port around the center. Using sterile technique, the needle is inserted into the center of the port.
Correct placement of the needle is confirmed by pulling back on the syringe and getting a blood return. Then the port is flushed by pushing in the saline. The saline should go in easily and not be painful.
After the port has been accessed and flushed with saline, a sterile transparent dressing is put over the site. Patients can be attached.
The nurse first washes their hands and then gathers the necessary supplies.
Before a non-coring needle is removed, the port will be flushed with normal saline and heparin.
Heparin minimizes the risk of blood collecting on the end of a catheter.
The catheter cap is scrubbed with alcohol for at least 15 seconds.
The needle that is on the outside of the skin is held with one hand, and the needle is removed by lifting up until the needle is out of your port and in the safety housing. The needle is discarded in a sharps container.